Good evening. My name is Adriana Garza, and this is my video journal assignment on the COVID-19 response in Texas. The importance of the issue of Texas's COVID-19 response. As of now, and from the end of 2019, considering the most abrupt situation, COVID-19 has been the most difficult issue for the entire world. Due to our government system, our federal system can only do so much to ensure the prevention of spreading the virus. Overall, that responsibility lies within the state system. Many states have declared restrictive measures such as lockdown, shelter in place, or stay at home orders to contain the pandemic at a local level. However, the wildly differing responses and response timeline, like Texas for example, has left people wondering if officials failed to take the situation seriously early on when they could have done more to slow down the spread of the coronavirus. The management surrounding the spreading of the virus has led to the effects of increase in COVID cases, business shutdowns, and unemployment, and most importantly, the death toll. Challenges surrounding COVID-19. The issue, other than being the spread of COVID-19 itself, is the prevention plan of the spread virus. Texas is one of the top 3 states in the United States with the highest number of COVID cases because of the deadlock of political parties. This division between the parties is what leads to inaction to combat the disease. Democrats want to enforce mandatory masks at all times and mandatory vaccination to public, whereas Republicans choose to embrace the freedom and liberty of not having to do either of the two, as freedom and liberty are an essential representation to our country. However, it is really the difference of opinion, beliefs, and ultimately pride that puts the prevention of the virus spread at a standstill. Addressing and solving these issues. The best way to approach this issue would be through the power of one's voice. As an American citizen who is also a Texan, the best way to address the situation is to inform and educate the public. If the politicians are too busy arguing amongst each other to not give a care about the COVID-19 spread, then it's up to the community that's going to grasp their attention. Criticism towards a solution. Despite the life or death situation surrounding COVID-19, political ideologies tend to blind the importance of the COVID-19 response to the public. Similarly, like the officials in office, the community's attitude has impacted and shaped by their political views. Response to criticism. The best way to approach a criticism is through fact-checking. Some will automatically refuse to listen, but by providing additional and thorough research, I could try to convince and sway those opposing the importance of the situation. An example would be like providing backup information and sources from the CDC, health professions, and hospitals, and other sources like the labor force union that provides information and statistics about the unemployment statistics. So, like I mentioned, backup sources. Over here on my left will be the total number of coronavirus cases in the U.S. as of November 11, 2021 by state. And as you can see here, Texas is number 2, right after California. And Texas is actually the second largest state in the U.S., so considering it being the second behind California, which is a smaller state, doesn't really say anything good about it. It's probably more than likely this has occurred because of the executive order of no longer enforcing mask mandates and the state opening up. Between 90 to 98% of hospitalized COVID patients, depending on the area, are unvaccinated. And because of that, just under half of Texans being fully vaccinated, the state still has some 16 million people who have yet to be protected from the virus. And those people are actually the people that are filling the state's intensive care units up rapidly. The impact of unvaccinated individuals is widespread and encouraging the continued spread of COVID-19. And with the no hope of virus mutation that somehow makes the virus more aggressive or more easily spreadable, it's actually 50% more transmissible than the original coronavirus strain. So, yeah. Because of the state opening up, like I mentioned, businesses are now opening up that were closed, which may sound good on paper. However, the virus itself does not care about that. So as more people start gathering up, opening business, that means the increase of COVID cases. And with the increase of COVID cases, that means the decrease of hospital beds. So yes, this is a very important issue, and it needs to be addressed rather quickly than sooner. And then on our right over here is going to be the unemployment rate in Texas throughout the years. So as you notice here, there's been a spike in unemployment, which was right before or like the pandemic. So it was very low right before this pandemic, as we can see, and then right during the spike point of the pandemic, you can notice there is an increase of 12.9%, and then it goes back to 6.5%. So it does decrease as of May 2021, which is a good thing. But the virus would continue to ravage the state throughout the pandemic, and the state's outdated and understaffed unemployment insurance office left many Texans struggling to receive unemployment benefits as they navigated the Texas Workforce Commission's confusing process. Business shutdowns and limit battered Texas companies. A decline in Texas's sales tax revenue, the largest source of funding for the state budget, initially spurred concerns about a budget shortfall. As I mentioned, May of 2021, as you can see here, the state had gained back around 1 million jobs since the previous spring. In April and May 2021 alone, like about 47,000 jobs were added in Texas. The employment rate did drop to 6.5%, higher than pre-pandemic levels, but around half of the record high, 12.9% from April 2020. So, although more people have been hired recently, many are still facing obstacles re-entering the workforce. On June 26, unfortunately, hundreds of thousands of Texans will lose the assistance they receive through two federal unemployment aid programs after Governor Greg Abbott opted the state out of federal aid. So, with these many conflicts within the Texas's government has deeply impacted not only the rise of COVID cases, death tolls, as I mentioned, but it has affected the life and social life of people all around. So, like I mentioned, the workforce, the safety, it's really difficult to jump back to it. And with Texas's government wanting to jump back to it automatically, because of the money loss, the importance of the lives and deaths of Texans all around aren't being considered. So, hence why I believe that the response to COVID-19 is an important issue as of now within our current situation. And that would conclude my video journal assignment. Thank you very much.